All right. Hello, everybody. Thank you so much for having us at this summit. Today, we are going to be speaking with you all about our use of a skills drill to assess Mpox response readiness at our local community hospital. My name is Marissa Morales, and I'm a senior infection prevention coordinator.
My name is Katie James. I'm the assistant nurse manager for the emergency department.
I'm Crystal Johnson, and I'm the Director for Patient Care Services.
I'm Lucy Witt. I'm an adult infectious disease doctor and the hospital epidemiologist. I'm going to start us off talking a little bit about the background of Mpox. We're going to talk about the history, how Mpox is transmitted, common clinical presentations, and information about the prevention and treatment of Mpox. Mpox is an orthopox virus. In the same family as smallpox, and the first human case was identified in the Democratic Republic of Congo in 1970. Prior to 2022, most cases were localized to Central or West Africa, with only sporadic outbreaks in the United States related to rodents or travel. In 2022, there was an outbreak of clade 2 Mpox, with over 30,000 cases identified. Most transmission was thought to be via sexual contact, and over 1.2 million doses of vaccine were administered. Although that outbreak occurred in 2022, transmission of clade 2 Mpox continues to current day. In 2024 and 2025, there were cases of clade 1 Mpox in the US. And clade 1 Mpox is unique because it's more severe and has higher fatality rates than clade 2. It's potentially more contagious than clade 2. And so far, there have been 11 reported cases of the US, including many without a known travel history. Mpox is transmitted by close contact, and this is a wonderful graphic from a great paper published in 2022 in Open Forum, Infectious Diseases, where you can see that in areas where Mpox is endemic, there's ongoing spread within animals and between animals and humans and within humans who have close contact. But in non-endemic regions, it's almost all human-to-human spread through close contact or household contacts. Because there's a concern that clade 1 Mpox is quite contagious and more transmissible than clade 2, the CDC recommends the following isolation precautions for anyone suspected to have Mpox: a gown, gloves, an N95 respirator, as well as eye protection. What are the clinical symptoms of Mpox? Well, many people experience a flu-like syndrome to start off with, but not everyone will experience this. And this flu-like syndrome is followed by a rash. And the rash is very classic in that it starts off almost as a pimple or a blister, and then slowly becomes painful or itchy. And this is a really nice diagram from that same paper in Open Forum Infectious Diseases, where you could see the stages of the Mpox lesion, starting with just a macule into a papule. It almost can be pustular, looking like a folliculitis, and then becomes vesicular and can resemble a herpes virus. And then it becomes pustular with a very classic umbilicated center, and then it scabs over. With the rash, there's often fevers, chills, swollen lymph nodes, headache, muscle pain or myalgias, and sometimes even respiratory symptoms. And transmission is possible from the time the symptoms start until the rash has fully healed and a new layer of skin has formed. How do we prevent Mpox? Well, luckily, there is an effective vaccine called Jynneos, which is a live, non-replicating Vaccinia ankara vaccine. It is administered in 2 doses, 4 weeks apart, and it's been FDA approved to protect against Mpox or smallpox since 2019. And its vaccine effectiveness has been estimated to be between around 66 to 90% effective with 2 doses, depending on how close to the vaccine administration we're talking. This vaccine is recommended for patients who have had known or suspected Mpox exposure, for men who have sex with men with a new diagnosis of an STD, those who have had greater than one sexual partner, those who have had sex at a commercial sex venue, or sex related to a large event or a setting where Mpox transmission is occurring, anyone who's having sex with someone who would qualify from the above statement, anyone who's traveling to a country where clade 1 Mpox outbreaks are occurring and anticipate sexual activity, or anyone who has occupational exposure to orthopox viruses. Treatment for Mpox, we are still trying to figure out the best treatment. We know that pain control is incredibly important as these lesions can be quite painful. So pain control is the first thing you have to make sure you provide to these patients. Unfortunately, there are no FDA-approved antivirals for Mpox, but work to understand the best treatment for these patients is ongoing. I'm going to hand it over to Marissa.
Thanks, Lucy. So now I'll be talking a little bit about how we can start improving general preparedness. So thankfully, the Joint Commission National Performance Goals have been added to help support this. So National Performance Goal 05.02.01 says the hospital implements processes to support preparedness for high consequence infectious diseases or special pathogens. This being added to Joint Commission National's performance goals offers us additional support to help advocate for these types of initiatives. Preparedness initiatives support timely identification, isolation, and informing of necessary parties through screening at points of entry to the hospital for specific symptoms and for travel history. It allows us to isolate using appropriate transmission-based precautions and inform people with procedures that are necessary for informing public health authorities and key hospital staff. The simulation exercises also allow us to observe PPE, including proper donning and doffing techniques, infection prevention and control procedures to support safe provision of patient care. And they allow us to observe procedures for managing waste and cleaning and disinfecting patient care spaces, surfaces, and equipment. So exercises give healthcare workers exposure to the processes that they will have to implement in a real life scenario if they encounter a suspected or a confirmed special pathogen. They allow healthcare workers to practice these sometimes really new processes in a safe environment, and they allow them to see what it's like to do so while still providing high quality medical care to the patient. Again, focusing on those critical steps for rapid identification, isolation, and informing of all necessary parties. So I briefly mentioned a few components that can be evaluated through simulation exercises, but I'll go ahead and I'll speak through some of them in a bit more detail here for some awareness. So capacity. This is important because when you're preparing for an exercise, you want to know, does your facility have the adequate capacity in terms of staffing, space, supplies, or systems to be able to appropriately respond to the type of emergency that you may be expecting? So staffing, that looks at healthcare workers and support staff. So we want to know, do we have enough nurses and physicians, allied health professionals, so our lab colleagues, respiratory, EMT who may be assisting with transport, and support staff such as our environmental services or EVS staff members, food and nutrition and supply management, members who are available to support some sort of response. The space is important because we want to know if we have the appropriate number of available beds, depending on how many patients we're expecting. If negative pressure rooms are available in case that is needed, and where the PPE cart is going to be located for staff to easily use and recognize where that is at to protect themselves and the patient. Supplies, wanting to make sure that we have enough supplies readily available on site in case we do need to tier up some sort of response. So we're looking at all of our equipment. Do we have the equipment that is necessary to help provide the appropriate care for this patient of interest? The medications that are needed to help treat these patients. And again, PPE availability, again, to protect our staff and the patient. And then making sure that our systems are able to have the capacity to respond to these. So do we have the processes in place that are needed in order to support a response? And does our command center have the capabilities to help organize a response? So this is really important because it helps lends to operational coordination. It can help assess the ability of our different leadership members, including infection prevention, public safety, to coordinate decisions, share situational updates, and align operations with external agencies as well, such as our local and state public health colleagues during an event. Communication is a critical piece to evaluate during simulation exercises. It's part of the isolate, inform, and identify process. And communication, we are able to test various forms of this. So one of them being our internal notification cascade. So if a patient does come into our ED, and the primary nurse or the triage nurse recognizes this, who do they notify? So we can go ahead and we can start getting our response ready. Do we have a phone tree set up so folks are aware exactly who needs to be called and who is going to be calling who? And are those phone numbers readily accessible? Patient visitors, if a patient has somebody who is accompanying them or would like to visit them, who is going to be communicating directly with those visitors? And what does that communication look like? Can we communicate directly with them? And also, can the patient communicate directly with them, or do we need to find alternative methods of communication, such as using a cell phone or an iPad of some sort? And who's communicating with the public health department and notifying them that we have a suspected high consequence case? A lot of times that may be our hospital epidemiologist or somebody else on the infection prevention team, but it's important to really parse through who's going to be making that notification ahead of time. External media is another big thing that we may encounter. We know that when high consequence infectious diseases or special pathogens are presenting to our hospitals, a lot of times this gathers a lot of media attention. So knowing who is going to help coordinate those communications will be helpful to identify ahead of time so that person is able to just quickly put together messaging and start responding that way if that is something that we choose to do. And of course, as I mentioned before, activating the incident command center and starting to get messages through to support coordination throughout your hospital. And then we know that consistent, clear messaging starts within our own teams and extends to our patients. So if all of these things are in line and we are able to have a strong, clear, concise message on the situation that's going on and our expected response, we're able to share that with the whole team system, and then that also will ultimately reach the patient, of course, and hopefully will reassure them that they are in good hands and will be taken care of appropriately. We can also and definitely want to evaluate our personal protective equipment or our PPE during exercises. We know that PPE is not always intuitive, especially for some of our more high consequence infectious diseases where more PPE may be required. Repetition can really help this. So simulation exercises allow us a platform to test this, test the donning and doffing process, see where any snags or gaps may be present so that when staff may have to actually use this with a real patient care scenario, they are more familiar with it and know what it should feel like to be on and how it should feel to take it off as well. We know that our PPE can be different depending on the pathogen, the patient, and the healthcare provider. PPE requirements may not always be clear. So, if a healthcare worker sees a rash, for example, their first thought may not always be to wear a mask of some sort. So, recognizing and testing PPE requirements through exercises for different pathogens can also help with that exposure and critical thinking for our staff members. And then always we know that PPE breaches may and they do occur. So testing PPE breaches as well in our exercises allow staff to be able to have that exposure in more of a controlled environment and know what to do if that did happen in a real life scenario. So hopefully they will be more at ease in dealing with that if that does come up. We also test our specimen collection and transport processes. We want to know that we have the appropriate supplies available. This is also, as I mentioned, with the capacity. So knowing that we have the capacity to respond with the appropriate number of supplies and also just the appropriate type of supplies. We want to make sure we have the right tubes, specimen canisters, and transport containers, because we do know that there are specific requirements for specimens being tested through high consequence pathogens through the Department of Transportation. So we want to minimize our risk where it is possible. So if a high consequence pathogen is being considered, potentially consider putting an absorbent pad below the area of the specimen. So if any leakage does occur, that is sort of contained a bit more as where possible. And there may be temperature requirements. So knowing that ahead of time and testing how maintaining those temperature requirements will be done is helpful to do through exercises so staff are familiar with that process. And then, of course, we know that a lot of times coordination with our external lab partners are needed and couriers are needed for transportation. So testing this allows us to really have a plan mapped out and work through any kinks that may come about ahead of time. And then waste management. We know that there are different types of waste in our hospital systems, and for some of our special pathogens, our will lend to category A waste. With this, sometimes we may require external waste management facilities. So knowing that category A waste often requires that level of coordination and figuring out at what point we're going to communicate with these external facilities and who's going to do that coordination will be important if that test result does come back positive for our person of interest. And then always we want safe waste disposal for both our solids and our liquid waste. So testing out different processes, like I mentioned before, potentially the use of absorbent pads can help us when we do encounter a real life situation. So some key considerations for exercise planning that hopefully we can all take away as well is the type of exercise. I've talked a lot about testing things through simulation exercises and really seeing what things look like in real time. But tabletops are also a good type of exercise that we can use, and oftentimes a more cost-effective way that we can test different real life scenarios that may occur. So through a tabletop exercise, a lot of times what you have is you have a situation or a scenario printed out and you invite all of your key stakeholders to the room. You go through the scenario and everybody talks through what they would do in an event of, let's say one of these special pathogens or high consequence infectious diseases. Whereas the simulation drill, you really go and you act out what you would do. Like I mentioned, a lot of times simulation drills use a lot more resources. So you may use a lot of your equipment, including PPE, and then also staff time. So those can be challenging. So just figuring out what works best for you in your facility for the type of drill or exercise that you think would be most appropriate for what you're trying to test. And then identify and involve relevant stakeholders. So maybe we want to make sure, for example, that the ED team on shift doesn't know that this is a drill until that same day. So in your planning efforts, consider involving the leaders. This can provide insight on days and times that may be slower, where the exercise may then also be more appropriate. And this also allows maybe involving security ahead of time because they can, if you're doing a simulation exercise, this can help reroute patient and visitors to areas where the exercise is not actually taking place. So this, as to not incite any panic. But this ties with our next point of ensuring the involved parties know that this is a drill. A lot of times when we do simulation exercises, we say, exercise, exercise, exercise at the very beginning on an overhead page. So everybody sort of in the hospital and in that area knows that we will be conducting an exercise, and a lot of the actions that are being taken place are as part of that exercise. And so again, not to incite panic with patients, visitors, or staff members. And then revising our procedures and processes as we learn. Exercises, you learn so much through after action reviews and through your hot washes with your team. So going back and taking those lessons learned and looking at your procedures and where they may have been gaps and really working to revise those is a critical part of why we do our exercise planning as well. And so with all of that being said, I'm going to pass it over to Katie and Crystal to talk through a simulation exercise that we did put on for Mpox at our local community hospital.
Thank you, Marissa. I'm going to start off by discussing the purpose of our exercise. As Dr. Witt stated earlier, prior to 2022, Mpox was localized to Central West Africa with sporadic outbreaks in the United States related to rodents or travel. In May of 2022, we started seeing an outbreak of Mpox in the United States not related to travel or rodents. This prompted the infection prevention team to develop a playbook for the hospital's point of entry to assist with Mpox identification and management. This playbook was developed and disseminated to our care teams in May of 2022. After socializing the playbook, we wanted to test the staff's ability to rapidly and safely identify, isolate, and assess potential patients with Mpox and inform appropriate parties. Engaging the right stakeholders is important to ensure the exercise is realistic, effective, and useful to prepare the care teams for a real situation. Since our departments don't operate in silos, it's important to test the full system, which can help expose interdependencies, communication pathways, and gaps that exist. For this exercise, infection prevention collaborated with the planning team to ensure all key stakeholders were included. We included leadership from our emergency department, labor and delivery, emergency management, lab, environmental services, patient access, and security. The main components of the exercise template included role assignments, purpose and scope, capabilities, objectives, and the case scenario, which we will discuss in the next few slides. The roles in the template we used included a controller who was the Mpox patient, evaluators who observed each area and provided feedback and informed the after action for each area we tested, a facilitator who provided real-life updates to participants, and players who are the frontline staff members. All participants had authority to stop the exercise at any point due to real-life events or safety issues. The objectives of the exercise were the following: determine the time it takes the facility to identify a potential patient with Mpox and begin exposure mitigation procedures in the emergency department triage area. Assess staff adherence to key infection control measures. Assess the immediate internal notification process. Assess capability to manage waste and specimens, and determine facility capability to make the necessary notifications. The scope of the exercise included the following. It was an unannounced exercise. It took place in the emergency department and in labor and delivery. It was limited to 1 hour per department. The exercise began when the patient entered the emergency department, and it concluded at the point of initial evaluation and/or the decision to notify the State Department of Public Health. Alternatively, the exercise would be terminated if the wait for triage exceeded 20 minutes or if the wait in isolation exceeded 40 minutes without the patient being evaluated by a clinician. The scenario is important to capture the clinical picture in a realistic manner so that an exercise is not automatically assumed. There are objective symptoms that may not be able to be replicated, such as a fever or rash. In this case, prosthetics were used to create an appearance of the controller being pregnant. Prosthetics were also used to create a rash that was semi-realistic. To enhance realism, this patient was registered in the live electronic medical record, which allowed for standard workflow to be followed. The scenario was the following: a 24-year-old pregnant female that is 30 weeks gestation. The patient presents at the emergency department from urgent care, stating that urgent care thinks the patient might have Lyme's disease due to a recent tick bite and should follow up at the emergency department for further evaluation. The patient presents with nonspecific viral symptoms of a fever of 100.1, chills, headache, body aches, fatigue, and swollen lymph nodes. The patient also presents with a rash that looks like pimples found on the neck, hands, arms, and stomach. The patient had no recent travel and no past medical history. After testing for Mpox is complete, the patient begins to have regular contractions that are approximately 10 minutes apart, requiring evaluation by labor and delivery. To note, ensure Mpox suspicion is not handed off to labor and delivery to evaluate the labor and delivery team's ability to assess. I'm going to hand over the presentation over to Crystal to discuss the additional considerations for the template we used, highlights, after actions, and key takeaways.
Thanks, Katie. So the exercise template that we used also included conduct, assumptions, artificialities, as well as a hot wash as considerations for our exercise. The conduct of an exercise are the rules that exist during the exercise, which may include but are not limited to reasons to terminate the exercise, the extent of testing that will be allowed, for example, blood pressures versus lab draws or imaging, as well as real-life situations that could pose a risk to the exercise participants, or when the exercise itself may pose a risk to real-life treatment of patients. The assumptions section considers the items that are in place that will be assumed to be followed to test the drill as realistically as possible, such as existing policies and protocols. So in this instance, as a part of our exercise, it would have been the playbook that was developed. Artificialities are considerations that will present within the exercise as not being real. In this case, an example of this is the rash and pregnancy, which you can see in the picture on this slide. Lastly is the hot wash. A hot wash is an immediate debrief with the team that reviews the exercise highlights and areas that could be improved, not only from opportunities discovered during the exercise, but also the composition of the exercise itself. Maybe the time that it was held or the departments and different factors like that. This will also help you identify items for your after action. So some highlights that we had for our emergency department was that the patient was identified as having a contagious infection early on based on the symptoms. They did a really good job at identifying the infectious component of it, but they also caught on very quickly that this was a drill based on the patient's presentation. So the patient was placed on appropriate isolation and appropriate PPE was adhered to during the entire patient encounter. The infection prevention team was notified right away and the specimen was collected. After the specimen was collected, the patient started presenting with contractions as stated in our scenario. Labor and delivery was notified and the patient was transported to labor and delivery. And the ED intentionally did not communicate the status of Mpox during handoff. So labor and delivery highlights. The patient was brought up to labor and delivery from the ED and placed in an isolation room. And it did take the labor and delivery team quite a while to figure out that this was an exercise. So that was good for real life subjectivity. So the Mpox binder and appropriate isolation was used after Mpox was suspected. And at this time, they still were not aware that this was an exercise. So we felt good about our prosthetics. And then instructions on how to page infection prevention was not available in our Mpox binder. And so there was a delay in specimen collection because they were not aware of how to contact infection prevention for further guidance. And so after infection prevention was contacted, the nurse did complete the screening tool questions and confirmed next steps with infection prevention. It was right around this time that they realized that this was an exercise. A specimen was collected and patient was discharged and told to await to hear from the local health department for their results. So the highlights were taken from our hot wash. And so with that, we did identify several areas of opportunity that we included in our after action. So during this, the swab tips that they used to collect the specimens were not perforated and didn't fit into the specimen tubes. And so we realized very quickly that we needed to order new swabs that had the perforation. So that was a quick win for us. Staff did not know how to page infection prevention. This was specifically in labor and delivery because they don't have to page infection prevention as frequently as the ED. So we did create a tip sheet on how to page infection prevention and added it to our Mpox playbooks. Infection prevention did not hear the overhead page. So when labor and delivery didn't know how to contact the person on call, they did an overhead page. And the infection preventionist did not hear it. So we did make sure that our facilities team tested our paging system to verify that it was working properly, and it was. So we felt good about that. And then knowledge of transport procedures for patients on isolation precautions. We did have existing guidance in our policies, but not specifically in the playbook to highlight that for Mpox. So we did take our existing guidance and added it to our playbook. And then we did have questions about the ED waiting room guidance and was not something that we had really considered before that. And so we collaborated with our epidemiology team to help provide waiting room guidance and added that to our playbook as well and made sure that we made those aware that were in the waiting room area, such as our patient access staff and security. So we also had takeaways for lab and EVS. And so for the lab, there was a gap in knowledge on the PPE for specimen handling. So the infection prevention team did provide education to the lab team and ensured that appropriate PPE was available. The cooler, they did not have a cooler available to handle the specimen within the lab after it was prepared to be able to send to the state lab. So we were able to have another quick win, purchased a cooler. We also did not have a clear process to identify category A versus category B samples or patients for lab and EVS. So we did develop a communication process on how those teams would be notified and also signage or labeling for our lab containers. And then the process for category A waste management was also not something that we use ever. And so we did contact our third party that we use for our waste to ensure that we were clear on the processes that we would need to follow for waste management. And so we were able to confirm the processes that we suspected. And we're able to provide that clarification to our teams. And then we also had unclear guidance on if terminal cleaning with a UV light was required. So we do UV light cleaning with certain organisms or infections. And so we collaborated with our epidemiology team to develop cleaning expectations for our environmental services staff as well. So key takeaways is that a simulation exercise allows you to evaluate current practices and really understand where to target your improvements. Including the right people in planning will help you have a well thought out and realistic exercise. And then it will also to make sure to test your actual systems to the extent possible, including coordination with external agencies is critical. And then clear communication, as we've talked throughout the entire session today, that clear communication is key, both to know who is doing what during either an exercise or a real life or in a real life situation, and to make sure that we don't have any gaps. And so clear communication is always good. And we thank you for joining our session today. We will have resources available to you uploaded as well.